Doctor, do I need a brow lift or an upper eyelid blepharoplasty or both? Hi, I'm Dr. Christopher Zoumalan, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique. It's a really important decision when it comes to rejuvenating the upper third of your face. And that's where patients come see me for my expertise and my recommendations as to what would be the best option for you. There's no cookie cutter option that's available for all patients. Every patient has their own customized plan with me when it comes to desiring an improvement in the upper third of their face. Let's start with the basics. A brow lift helps improve sagging and low set brows. Brows that are particularly low set, perhaps laterally, that are causing some hooding. A brow lift helps improve the position and shape of these sagging brows in patients to offer a placement that is more in line with what they had when they were younger. In contrast, an upper eyelid blepharoplasty improves excess eyelid skin. That is not the same as sagging eyebrows. Eyelid skin is when you can actually pinch this extra eyelid skin and notice that that excess skin, when removed, can actually improve the upper eyelid appearance. That is completely separate from a brow lift. When I do upper eyelid blepharoplasties by themselves, usually in the office under local anesthesia, I will always pinch that skin to confirm that what I'm removing is going to help improve the upper eyelid appearance, but also to make sure that amount of skin is safe to remove without causing any issues of patients not closing their eyes, for instance. And sometimes it's not just an upper eyelid blepharoplasty or brow lift, it's both. Now, what's interesting, in many cases, patients come see me pretty confidently that they need an upper eyelid blepharoplasty. But what's actually the issue is the sagging and drooping brows is causing an apparent excess skin. But by gently lifting up the eyebrows to where the patient's anatomy was many, many years ago, for instance, then the patient and I drastically see an improvement in what was considered excess skin, but actually is sagging brows that was causing the problem. So in that case, a brow lift is certainly indicated. Now, most often, when the brow lift is performed, upper eyelid skin needs to be removed as well, because there's still some component of excess skin. But by repositioning that brow to where it was many years ago and rejuvenating the look of that brow and giving it more of a youthful look, there's still potentially some excess skin that's present, but much less than what you'd expect, because most of that issue was addressed by performing the brow lift. That's where a brow lift can actually reduce the amount of skin that's needed to be removed. There are patients that are very adamant that they do not want a brow lift, and we'll talk about reasons why they think that and why more and more patients are becoming more comfortable with a brow lift. But those patients that really do not want to have a brow lift and actually need a brow lift and are adamant that they just need skin removed are usually the patients that will not be happy with an upper eyelid blepharoplasty, because an upper eyelid blepharoplasty alone is not going to address their main issue. And so I spend a lot of time in these consultations discussing with patients, showing them in person what their eyelids would look like with just an upper eyelid blepharoplasty, and then letting them realize that the brow lift would actually help them way more than they would ever imagine. In regards to performing a brow lift, there's several ways that I perform a brow lift. My most go-to approach is an endoscopic brow lift, where I make several small incisions behind the hairline to gently elevate the brow tissue to the desired shape and position. The endoscopic brow lift allows me to use a camera that's much smaller than my pen to go in with this camera, and I use a monitor to illuminate the image in the operating room to get a clear picture of the anatomy from the corner of the eyebrow, the tail here, all the way across to the other side. It's really important that I use this camera to gently dissect and identify where the nerves are, so I can avoid the nerves, I can avoid the large vessels, but also safely and accurately release all the tissue where I need to and visualize that so I can get the perfect lift. I'm able to do this through my endoscopic brow lift because I'm able to use these small incisions to see perfectly across the entire anatomy of the eyebrow. By performing an endoscopic brow lift, I'm able to not just lift temporally, but also lift here superior temporally and out here too. So I get a lift here and here. These two fixations allow for a much more longer lasting result and a much more successful improvement in the shape of the brow. Now, there are patients that come in and just want a temporal brow lift. I do temporal brow lifts. I personally don't prefer temporal brow lifts over endoscopic brow lifts because a temporal brow lift just uses 2 incisions versus the other 5 that I make. I still perform my temporal incisions when I perform my brow lift, but by doing just a temporal brow lift, it's very difficult to see in here and here to release adequately. And the fixation is usually just here and not here. So the lift for a temporal brow lift is very limited to just a temporal lift. And so patients that really have just temporal brow ptosis, and just want an improvement in the tail of their brow, the temporal part, a temporal brow lift can certainly be an option. But most of the patients that I see in my practice don't desire just a temporal lift out here. They desire a lift here and here to allow for the position to be improved to a more natural and elegant look. And that's where patients come find me for this procedure that I perform through my endoscopic brow lift approach. There are other types of brow lifts that I perform. One of them in particular is the direct lateral brow lift, and that is one that I can perform under local anesthesia along with an upper eyelid blepharoplasty. That's usually reserved more for my male patients or patients that have a lot of wrinkles in their forehead, that I can hide the incision. It's called a direct lateral brow lift because the incision is directly made above the eyebrow. It heals very well. I do a lot of these procedures, more particularly in men, but also I do them in some women that really do not want to have a complete brow lift. They don't want to be put under general anesthesia for reasons that they have, and they want just more of a quicker procedure. It certainly is an amazing procedure for the right patients, the patients that really just want a temporal lift and are okay with having a small little incision placed above the brow. Again, the way I close it is very important because I want that incision to heal as well as possible, and I try to make it heal as possible to a natural wrinkle that you have in the forehead. This offers a direct improvement in the lateral portion of that brow, and I often do this at the same time with an upper lid blepharoplasty. So that's another brow lift that I like to do. Coronal brow lift is a procedure that I don't perform. It's a more older technique that essentially creates an incision from one side of the scalp and all the way to the other side. And so it's a fairly visible incision. You're elevating the entire forehead by making this large spanned incision. I personally don't like that look. It's a little bit overcorrected in many cases. It doesn't offer that natural look as what an endoscopic brow lift does. I like the look of an endoscopic brow lift. I'm really able to rejuvenate my patients' eyebrows to what they look like when they were younger. They still look like themselves, but they just have this look that just makes them look so much more youthful. And that's what I love about it, and that's what patients come see me for. Now, other times, a simple upper lid blepharoplasty is the right option for my patients, and they do not need a brow lift. So I don't like to do a brow lift on somebody that's not a candidate for a brow lift or it doesn't look good on them. A simple upper lid blepharoplasty can often be an excellent solution for a lot of my patients. Some patients come in and see me asking for a brow lift, and their brow position looks fantastic, but what they have is actually some asymmetric eyelid skin, and that's where upper lid blepharoplasty done under local anesthesia can be a great option for them. So, what's the right age for these procedures? Is there a certain age for an upper lid blepharoplasty? Is there a certain age that can be appropriate for a brow lift? The answer is really what your exam is. I have patients in their 20s that present to me with significant excess skin, and the skin is draped over their lashes. They're not able to see well, they feel heavy hooding all the time, and they just don't like their appearance. And I would certainly recommend an upper lid blepharoplasty for them. There are patients in their 20s, 30s, and 40s that have significantly low-set brows. And as long as they qualify and have low-set brows that are significantly bothering them, and that I feel that I can provide a natural look for them by performing a brow lift, we can consider these procedures for them. And another interesting point that I like to bring is I see a lot of patients that come in asking to have an upper lid blepharoplasty, asking to have a brow lift, and they're walking around with their eyebrows completely raised, using their forehead muscles. They may benefit from a brow lift, but what they may also need is a ptosis repair. So it's really important for me to do a full examination on my patients that think that they may need a brow lift or an upper lid blepharoplasty, but actually what they have is really low-set eyes. They have ptosis, and that can be done at the same time as an upper lid blepharoplasty and or a brow lift. And that's the beauty of my practice, and my specialty is that I'm trained as an oculoplastic surgeon to really dive deep and examine the eyelids from the level of where the eyelid is, how low the eyelids are, how much extra skin there is, and what the brow position is to really give my patients the best natural looking result. And when performed in the right patient, these procedures can last for many years, 10, 15 years for instance. It all depends on the skill of the surgeon and what kind of result that we can get you that's still a natural looking result, but also how you age, how you take care of yourself, and how your health is throughout the rest of your 10, 15 years ahead of you. It's important to stress that my patients should always live a healthy lifestyle, should always try to live a stress-free life as they possibly can, avoiding direct sun exposure. And especially if you're getting a brow lift, I do recommend my patients getting Botox injections a few times a year because that procedure can actually help prolong the results of a brow lift by preventing my patients from using their corrugator muscles to frown or using their forehead muscles a lot. And so that can allow the brow to kind of stay in a relaxed state longer than if you were just moving them around too much. So things to consider if you wanted to prolong the results of surgery. My patients find that very helpful. I've had patients return after a decade from having these procedures and they still look great, they're healing well, which is a great testament of the procedures and how long lasting they are, so long as you take care of yourself and respect your body. If you're thinking about having an upper lid blepharoplasty and or a brow lift, the answer lies in your anatomy. The answer lies in your exam findings. Through a personal consultation, we'll determine what your concerns are and how your natural anatomy and aging has led to what your concerns are and what we can do to help them. I'd love to meet with you and talk to you about what options would give you the best natural looking result for you. Feel free to call us or book directly through our website for a consultation and or a virtual assessment where I can take a look at your pictures and see if I'm able to help you. Thank you so much for watching, and I look forward to talking with you or meeting with you soon.